Welcome everyone to the State of the Sector, the Strong Nonprofits for a Better New York's response to Governor Cuomo's State of the State, which took place over the last 4 days. Strong Nonprofits is a coalition of over 350 human service organizations across the state of New York, providing a variety of services from homeless services to childcare, senior services, substance abuse prevention, foster care, and a myriad of other services. We have all come together to continue to fight for our communities and demand a budget that is equitable, supports our workers, and ensures nonprofits have the resources they need to serve communities. Today, we're going to hear from some of our great partners who are going to reflect on the governor's State of the State address with our own State of the Sector address. So first up, I'd like to introduce my partner, Loretta Zolkowski, the Executive Director of the Human Services Leadership Council of Central New York.
Thank you, Michelle. The Human Services Leadership Council of Central New York is a coalition of over 70 human services not-for-profit agencies serving the greater Syracuse area, Onondaga County, and surrounding counties. Throughout this pandemic, our member agencies have been providing vital services to people in Central New York communities, life-saving, essential services, food distribution to families and seniors, homeless and domestic abuse shelter operation, substance abuse and mental health services, operating the 211 hotline, and more. Additionally, human services nonprofits have partnered with local government in Central New York to promote COVID-19 testing and now vaccination. The skilled, dedicated employees of these agencies have each day been on the front lines, risking their health and well-being to serve people in need. Yet New York State has failed to recognize human services agencies workers as essential workers. This is unjust. Worst of all, the extraordinary efforts of these essential workers have been undermined by New York State's actions. The funding cuts, contracting and payment delays, have in some cases cost some of these essential workers their very jobs. Salvation Army, ACR Health, and other nonprofits in Central New York have reduced staffs as a result of funding cuts, and this has directly impacted the most vulnerable populations in Central New York. In his State of the State address, Governor Cuomo stated that the public is tired of unfilled political promises, that results are the solution. I agree. I join my colleagues in Strong Nonprofits for a Better New York coalition in calling upon Governor Cuomo to recognize nonprofit human services workers as essential workers and to support their vital work by ensuring full funding of state contracts in the fiscal 2022 budget and the restoration of prior funding cuts. It is imperative to invest in New York responsibly and raise revenue by enacting sensible revenue-raising policies. Human services nonprofits are delivering results. We call upon New York State to deliver results in return. Thank you.
Thank you so much, Loretta, and thank you for highlighting the human services workforce. I now like to turn to Keith Little, President and CEO of SEO Family of Services.
SEO Family of Services is a multi-service organization providing services in New York City and all of Long Island, servicing over 60,000 individuals each year. Long before COVID hit, state government asked the human services sector to do more with less. With the pandemic, the situation worsened. The state of New York has stopped paying contracts fully and on time for services already rendered to New York residents and communities. The withholding of 20% from the state contracts is shaking the financial foundation of nonprofits and jeopardizing the health and well-being of thousands of New Yorkers who rely upon us. Critical services are at risk. Services that help individuals with intellectual and developmental disabilities at SEO are at risk of losing access to essential lifelines of support while providers suffer deeper economic harm. The state needs to act now. The population we serve, predominantly in the communities of color, which have been disproportionately impacted by COVID-19, has greater needs than ever before. In addition to critical human services, they need food, housing, jobs, and healthcare. They need and deserve more, not less. At SCO, the 20% withholding has and will result minimally in a $660,000 loss in fiscal year 21, with little clarity if the withholding will be permanent for fiscal year 22. Additionally, SCO is owed $5.4 million in reimbursement going back to New York State fiscal year 2015-2016 related to rate reconciliation that SED has not approved for SCO for reimbursement by local school districts. Movement has been painfully slow. The state agency's current practice of delaying payments and withholding 20% from contracts has placed nonprofits in a precarious position. New York's nonprofits continue to be dedicated to improving the lives of those we serve. We are committed to the families, the communities, and employees who depend upon us, but the current financial trajectory is unsustainable. We cannot continue to do more with the state stepping up and fulfilling their contractual obligations. If the state does not agree to honor contracts quickly enough or at all, the results will be catastrophic. Thank you.
Thank you so much, Keith, and thank you for highlighting the 20% withholding, which is, as you said, absolutely will be catastrophic and already is for human service providers across the state. Next, I'm going to turn to David Condiff, the Executive Director of the Center for Community Alternatives.
Thank you, Michelle. The Center for Community Alternatives provides alternative to incarceration and reentry services throughout the state, from offices in New York City, Syracuse, and Rochester. Not widely appreciated is the fact that nonprofits like CCA save the state a lot of money. Incarceration is an exceedingly expensive response to crime. 4 years of prison time for one individual costs roughly $250,000. A community-based alternative costs $5,000 to $10,000. As an example, our state-funded sentencing mitigation contract not only serves people in community, but it literally saves the state millions. Certainly in a fiscal crisis, the state would not do anything to jeopardize such a contract, right? Wrong. The current policy of withholding 20% on contracts and then delaying offering a new contract puts this entire program in serious jeopardy, and thus is hampering an opportunity for the state to save money at precisely the time it most needs to do so. In addition, the mere threat of reduced funding on the part of the state has put a severe crimp on county and city funding, which then also hurts nonprofits. For example, CCA's Freedom Commons Academy is a pioneering reentry housing program developed with a $14 million state investment in brand new construction. It now operates at an unsustainable loss because the county, responding to state budget cuts, has cut CCA's homeless shelter funding in half. This not only hurts people who desperately need to avoid shelter in the streets, it also puts this $14 million state investment at serious risk. Current government policy on contracting with nonprofits, in particular, the expectation that nonprofits will provide services without knowing when or if the state will execute a contract, puts our nonprofits in an impossible financial situation. Every month without a contract digs a deeper hole. The prudent thing to do is to close the program down. And yet all of us in the nonprofit sector know how desperately our participants need our services to continue, especially during a pandemic. Therefore, we call on the state to recognize the nonprofit sector as an essential partner in the recovery from COVID that we all seek. Thank you.
Thank you so much, David. And now we're going to turn to Corinne Hammonds, the President and Chief Executive Officer of Little Flower Children and Family Services of New York.
Thank you, Michelle. Little Flower serves children and disabled adults through residential and community services throughout downstate New York. The need for human services has increased exponentially during the COVID-19 pandemic. Workers in the human services sector immediately stepped up, rapidly adapting and transitioning service delivery models to meet residents and communities' needs. At Little Flower, our 24/7 services across Brooklyn, Queens, Nassau, and Suffolk have remained open throughout the pandemic. The state must continue to recognize human services workers as essential. It is crucial that these essential workers receive emergency pay for their vital work in the era of COVID-19. At Little Flower, we have committed to providing enhanced pay to employees who are working directly with COVID-19 positive residential clients. For the most part, this is a fully unfunded cost. We know these funds must come from somewhere. We agree with the governor about a brighter future ahead. Despite New York's anticipated revenue shortfall in the coming budget, the state must invest in New York nonprofit missions by stabilizing our revenue. COVID-19 has hurt all New Yorkers and harmed our state economy. New Yorkers are suffering. Budget cuts would only cause more harm to New Yorkers and put their lives further at risk. Governor Cuomo must invest in New York responsibly by enacting sensible revenue-raising policies. Long before COVID began, the state had asked nonprofits to do more with less. With the pandemic, the situation worsened. We urge the state to pay contracts fully and on time for services already delivered to New York residents and communities. Any withholding from state contracts disproportionately impacts New York communities that have already been hardest hit by COVID-19 due to structural racism, ableism, and income inequality. Little Flower stands with the governor in the commitment to addressing systemic racism. Little Flower would like to thank Governor Cuomo for prioritizing our residential care staff and vulnerable adult residents in the first phase of the vaccine distribution. This will help our frontline staff perform their essential duties safely and protect our employees and clients. Furthermore, the governor's decision to implement and expand telehealth services helped improve health equity during the worst public health crisis in a century. These actions by the governor were a bright spot in an otherwise dark time. More is needed to ensure the long-term viability of nonprofits in New York. Thank you.
Thank you so much, Corinne. Now we turn to Chris Burke, the Chief Executive Officer of Unity House.
Thank you, Michelle. Unity House is a capital region human service organization dedicated to meeting the increasing needs of disadvantaged people and helping them lead productive and healthy lives. We celebrate Governor Cuomo's aspirational focus in his 2021 State of the State address and look forward to the role that the human service sector will play in building back New York even better. In fact, we are well aware that without the human service workforce providing supports, including food, housing, childcare, and domestic violence services, many New Yorkers would have suffered far worse in 2020. The need for human services has increased exponentially during the pandemic as New Yorkers struggled with economic uncertainty and social isolation. Human service workers immediately stepped up, rapidly adapting and providing and transitioning service models to meet residents and community needs. And they also put themselves on the line, their health and their safety, their lives essentially as well. It is past time for the state to recognize human service providers as frontline essential workers. We are particularly hopeful for how initiatives introduced by Governor Cuomo will benefit the people we serve, and I want to mention a few. We applaud programs that will increase affordable housing and codify protection for renters. All such initiatives should be implemented throughout New York State, not just in New York City. The initiatives to combat domestic violence and gender-based violence are spot on and forward-thinking. And the governor's proposals to make childcare more affordable and equitable for our most vulnerable children and families are perhaps the most impactful for low-income families. Most New Yorkers probably recognize how expensive childcare is. Oftentimes, it's higher than a mortgage or rent payment. For many families we serve at a Child's Place at Unity House, quality, affordable childcare is necessary for a family to achieve their dreams of a financial, sustainable balance. Governor Cuomo's proposal to ensure that no New Yorker will pay more than 20% of their income above the poverty line towards childcare is the right solution. We join with the governor in hoping for justice and fairness from Washington, recognizing that federal aid is the most reasonable way to address the budget shortfall. We are also certain that the proposed cuts in the current budget are exactly the wrong proposal because they would not only not honor the governor's commitment to racial and economic and social justice, but would be counter to it. Such cuts will harm the most vulnerable New Yorkers the most, including the human services workforce, which is largely comprised of Black and Brown and women and people who are struggling themselves financially. At Unity House, we believe in making life better for people, the people we serve, and we agree with the governor that in New York, it must be aspirational for all. Excelsior, ever upward. Thank you.
Thank you so much, Chris. Really appreciate that. Appreciate all of our speakers so far today, highlighting really important issues that I just want to reiterate for everyone. The nonprofit sector in New York is the largest private employer in the state, employing about 20% of all workers. Human Services specifically employ over 800,000 people just on state government contracts. The governor's state of the state, however, made no mention of the sector in over 4 days of speeches. It's an oversight that we at the sector have gotten used to, but in particular this year, the failure of the governor to recognize and collaborate with the sector is more egregious than ever before. Human services workers were and continue to be on the front line of fighting COVID, making sure that people stay home, stay safe, and stay alive. Providers have kept shelters open for children, seniors, and those experiencing homelessness, putting their own lives at risk and often losing their lives during the pandemic to make sure that those facilities stayed open and safe. They've pivoted to remote services and provided technology for children to learn, for people to continue accessing counseling, and for seniors to stay connected. They've continued home care and home delivered meals so that those most at risk can stay at home. This heroic work has been met by the state with delays in contracts and the withholding of payments, as my partners have pointed out. The state is holding back 20% of all contracted dollars while asking providers to continue to do 100% of the work, and in many cases, because of increased need, doing more than 100% of the work. To add insult to injury, that withholding could turn into a retroactive cut, and if that happens, vital organizations across the state will close down. Human service organizations cannot survive a 20% retroactive cut on their contracts, especially when there's so much need in communities. The governor has also sat on billions in CARES Act funding, while other states have pumped that money into the nonprofit sector to help those communities. The governor must agree to release the CARES Act funding and also to a revenue agenda put forward by Invest in Our New York and make crucial investments in the human services sector, because we know that human services are how New York recovers from COVID-19. The human service sector has not only responded to COVID during the worst parts of this pandemic, but as we look to recovery, the human services sector will be more important than ever. People now need to stay home. That's telehealth visits, that's home visits, and home delivered meals. People need access to food. People who were income insecure and now as unemployment rises, more people are food insecure, having access to food pantries. People need to, in order for us to recover, they need to go back to work. No one goes back to work until there's childcare. And we know there's millions of people who are looking forward to going back to their offices, and childcare is essential to that, as is school wraparound services like after school and early learn. People need to change jobs because the market has changed. So there will be a need for more employment and training. And people will continue to need economic assistance, including eviction prevention and benefits screening. There is no recovery without nonprofits. And I want to say that again. There is no recovery in New York without the nonprofit human services sector. We hope that the governor will finally recognize this and pay our providers fully and on time for the work that they have done, that he will pass a budget that makes zero cuts to this crucial sector, and will also pass a revenue agenda that will help New York get back on track. I next want to turn it over to our final speaker for today, which will be Maria Dibble, the Executive Director of the Southern Tier Independence Center.
Hello, I'm Maria Dibble from Southern Tier Independence Center in Binghamton, New York. Our organization works with children and adults of all types of disabilities to help them to live independent lives in the community. In this past year of COVID-19, our employees were steadfast in working with their consumers face-to-face, even in the worst part of the pandemic, in order to provide this critical supports that people need to live as independently as they can, or even to live. STIC lost $247,144 through the end of December due to the 20% withhold. And we expect that is continuing, and we don't know for how long. This caused us to cut back on expenses and on staffing. This harms the services that go directly to the people we support. This cannot continue. We need the governor and New York State to live up to their obligation that is provided for within the contracts to meet the needs of people with disabilities across the state. This is a critical issue. Every member of the not-for-profit sector is in danger. We need to do something to change this. This has to end. We need to get new kinds of revenue, whether it's through taxing or other mechanisms. We need to see a change. Not-for-profits cannot continue to sustain these kinds of losses. I want to thank all of you for your time and effort in participating in this webinar, and we hope that you will take that message to heart. Thank you.
Thanks so much, Maria. And I want to thank you all for joining the Strong Nonprofit State of the Sector and thank our speakers today. We hope you all listening will join us on calling for the governor to protect, lift up, and partner with the essential human services sector that is absolutely vital in helping New York recover. We need a robust revenue package, a commitment to maintaining human services funding, and sadly, to ask the state to pay nonprofits fully and on time, really the bare minimum, for their contracted and absolutely crucial work. There is no recovery without nonprofits. Thank you so much.